today we are going to be doing goniometry measurements and manual muscle testing of the TMJ. We are going to begin with a cranial nerve assessment for the muscles of the face and the eyes. This is important to differentiate any weaknesses in the facial muscles or the eye muscles, such as seen in cerebral palsy as well as after a stroke. So first things first, we are going to have the patient open and close their mouth. Now we are going to have the patient open and close their eyes. And then we are going to have the patient attempt to raise one eyebrow and then raise the other one. There we go. Alrighty, everything looks good in the cranial nerve assessment. Next we are going to be moving on to goniometry of the TMJ joint. So, first we are going to be doing jaw opening, so that would be mandibular depression. Normal range of motion for mandibular depression is going to be 0 to 44 millimeters. I'm going to be using a smaller goniometry measurement taker today because we are doing a smaller body part. It is important to make sure that the patient is sitting in an erect sitting position as well as feet flat on the floor. So, I'm going to be using the stationary arm for my measurements today because I like it the best out of everything on here. So, the landmarks that we are going to be measuring from for mandibular depression is going to be the bottom of the top teeth and the top of the bottom teeth. So first we're going to have the patient perform mandibular depression. And back up. There we go. And now we're going to measure it. Sippy sippy.
Sorry.
Alright, so we're going to smile pretty for me. Alrighty, and now what we're going to do is you are going to open your jaw as far as possible. Alrighty. Our patient here has performed 60 millimeters of mandibular depression, and like we said before, normal range of motion values are 0 to 44 millimeters, so he can open his mouth a little bit bigger than others. Next, we are going to be doing mandibular lateral excursion. So we are going to have the patient smile, and then he is going to slightly open his mouth, and then he is going to simply move his jaw to the right, and then move his jaw back to the left. Alrighty. So the landmarks for this one is we are going to be using the middle of the teeth and on the top and the bottom. It is important to make sure that you are using precise midline for the teeth, just in case people's teeth are not correctly in line with each other. Or they may not have teeth. You might have to deal with that too. So, alright. Whenever you're ready, you're going to go to the right. There we go. Oh, no, go back. Go back really quick, and we're going to go to the left. There we go. And our patient here has about 20... Our patient here has about 12 millimeters of lateral jaw excursion to the left-hand side, and now we are going to measure the right-hand side. Whenever you're ready. Alrighty, and for the right-hand side, our patient has performed 10 millimeters of jaw lateral excursion. Normal values for this range of for this movement are going to be 0 to 10 to 15 millimeters. So our patient is in the normal range of motion. So now we are going to be doing mandibular protrusion. Mandibular protrusion is normally range of motion is 0 to 6 to 9 millimeters. So now for this movement, we are going to have the patient sit in erect sitting position, and then we are going to simply have him smile, and then he is going to jut his jaw forward. Yeah. So this one we are going to measure from the bottom of the superior teeth to the bottom and measure the difference between the bottom of the superior teeth and the bottom of the inferior teeth. Alright, whenever you are ready. Alrighty, our patient here has 6 millimeters of jaw protrusion, which is in the normal range of motion values. Next, we are going to be moving on to manual muscle testing of the TMJ joint. First, we are going to be doing mandibular elevation. So this would mean closing your jaw. Closing your jaw. There we go. Now, what I'm going to do is I'm going to hold the patient's back of their head and then hold their jaw just like this. Here and here. So now, what I'm going to have him do is I'm going to have him try and close his mouth, but I am going to provide force in a downward motion as if I wanted him to open his mouth. We are going to hold for 3 seconds, and then we are going to be relaxed after that. So open your mouth all the way. Now close a little bit. Nope, open a little bit. And now whenever you're ready, you're going to go against my resistance. 3, 2, 1. Oh, let's go one more time, considering he lost the position, and I don't know if that is from simply losing the position or because his masseter and temporalis muscles are not working properly. Up a little bit. And hold, hold, hold. Alrighty. From the second test, we can see that he has simply lost the position in the first test, and he would be graded a 5 out of 5 for this manual muscle test. Next, we are going to be holding the occiput on the back of the head as well, and then we are going to be holding underneath the chin, and we are going to be measuring the manual muscle. We are going to be forming a manual muscle testing of mandibular depression, which means jaw opening. So, whenever you're ready, you can open your mouth all the way. And now we're going to go back. And now I'm going to resist for at least 3 seconds. Whenever you're ready, hold, 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 and back up. He would be graded a 5 out of 5 for that one as well. Next, we are going to be moving on to protrusion. So, similarly as before, we are going to have the patient jut their chin forward in a forward motion. So I'm going to hold similarly, just like the beginning ones. We're going to have the patient jut there we go, and we're going to go back, and then we're going to go back, and then I'm going to apply resistance for 3 seconds. Hold, 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 and back. Last manual muscle test for the TMJ joint is going to be lateral excursion on the right side as well as on the left side. So I'm going to stand behind the patient, and I'm going to hold this hand here as well as this hand here. So I'm going to have the patient smile, open slightly, and then he is going to shift his jaw towards the right hand side. Alrighty, and now I'm going to apply force against lateral excursion to the right hand side. But just move just your jaw. There you go. Alright, ready? Go ahead. Hold, hold, hold. Now we're going to go to this side. Ready? Open, smile, open. To the side. Ready? Hold, hold, hold. Alrighty. In that muscle test, we are testing the medial pterygoid muscle. And our patient here has performed 5 out of 5s for the remainder of the muscle testing for the TMJ.